Dear D-Pharm students, this is our class 4 of Hospital and Clinical Pharmacy subject for Diploma in Pharmacy second year, right? So today's topic is about Hospital Pharmacist. In this video we'll be seeing uh, in this video we'll be seeing who are hospital pharmacists, what are their responsibilities, what will be their qualification and experience required, what will be the job specifications, what will be the workload requirements and interprofessional relationships of a hospital pharmacist. So overall this video is all about hospital pharmacist. Now, who are hospital pharmacists? They are the pharmacists who are working inside the hospital pharmacy, right? Inside every hospital there will be one pharmacy, no? So in that pharmacy, whoever is working as a pharmacist, he is called hospital pharmacist. So his main duty will be to practice medicines and dispense prescriptions, purchase, manufacture, perform quality test of all medicines used in hospital, right? So this will be the day-to-day tasks of a hospital pharmacist to perform. Inpatient pharmacist responsibilities. Now if we talk about the responsibilities of a pharmacist, so he will be having two types of responsibilities. One is for inpatients, like the admitted patients, and one is for outpatients, the patients who are regularly coming, not regularly coming, who are coming for daily checkup, like that. So for inpatient pharmacist, his working or the responsibility area will be also divided. First one, we will be talking about the dispensing area. Dispensing area means where he will be dispensing the drugs, right? Here his duty will be to ensure the compliance with hospital policies, okay, and also maintaining record, like whatever the drugs are there or whatever distributed, whatever investigational new drugs or like intravenous admixtures, whatever the drugs are there, just to keep records of everything and ensure that compliance of law and techniques for compounding are followed. Next, he should be also remained updated about drugs, including side effects and other therapeutic effects, okay. Next, he should be like having accuracy like in doses prepared, especially intravenous administration, okay. Next, he's also should be managing the stocks of the stored drugs, okay. There should be no mistakes, so that inventory management should be kept under him, and he should be nicely overlooking these things. Next, one more thing he should be doing is coordination, right? Manages all activities in the dispensing area, right? Next, he is having another duty in the patient care area, where he will be directly giving patient care to the patients, right? There his duty will be to coordinate with the pharmacy services in the nursing unit, okay. Next, he should be able to do communication nicely with the nurses and other medical staffs for smooth ongoing of the all procedures, okay. Next, in the technical part, he should be sharing technical instructions with technicians and ensures proper drug administration techniques, okay. He should be guiding the nurses, the technicians, the other medical staffs. Next, as a pharmacist in the patient care area, he is also responsible for the supervising of each and everything that's going on in the area, like medication check, unit dose system checking, or etc., like that things. Next, he also provides direct patient care, okay, in the inpatient cases, like patient's medication history should be known by him. He should be counseling the patients for betterment or the appropriate use of the dosage regimen. He should be able to identify drugs brought by the patients, so that if patient is coming with a strip, he should be knowing what medication it is, what is the use, so that he can guide the patient nicely. Next, he should be also selecting drugs according to the physician or the disease condition given. He should be also able to identify the drug specifically should be given for that condition. He should be also monitoring the patients nicely, and cardiopulmonary emergencies, suppose CPR is given, no, some in some emergency cases, so he should be able to identify those cases and be able to rescue the patient when needed. Now, as a pharmacist, he also performs duty as for the outpatients, okay. Now in outpatients also, he is having three central area to perform his duty. First one is central dispensing area, where he will be dispensing the drugs to the outpatients, so he should be ensuring correct compounding techniques are like used, and he also should be maintaining the adequate records, okay. Next, in patient care area, he should be given direct care to the patients by identifying the drugs brought by the patients to him and also assisting in selecting drug regimens and products. Okay, next, as general responsibility, he should be understanding and coordinate with the pharmaceutical needs of the out service area and manages all drugs properly. Also, he should be participating in the cardiopulmonary resuscitation, that is the cardiopulmonary emergencies. Okay, now in the next step of this video, we'll be discussing about what should be the qualification and experience requirements for a hospital pharmacist. Okay, now as a hospital pharmacist, he should be professionally competent and registered pharmacist, should be able to perform pharmaceutical services of the hospital. Okay, now the number of personnel depends in the hospital size and scope. Like एक फार्मेसी में या फिर एक हॉस्पिटल में कितना pharmacist होना चाहिए, that depends on the size of the hospital. Okay, now the director of the pharmaceutical services should be graduate or postgraduate from a recognized pharmacy college. मतलब the chief pharmacist, no, he should be like a graduate or postgraduate from a recognized pharmacy college and should be having some 2 to 5 years of experience as a hospital pharmacist. Consideration is given if they are done like they have PhD in pharmaceutical sciences. Now, what should be the abilities required for a pharmacist? Okay, so first of all, he should be able to administer like to do the administrative and managerial work. Okay, responsible for planning, implementing pharmacy policies, budgeting and maintaining records, all the official works as we say. Okay, and he should be familiar with the hospital organization and communication lines so that everything he can run very smoothly. Next, he is also eligible he should be also eligible for the manufacturing areas work ability, like developing pharmaceutical manufacturing programs to issue drugs at lower cost and prepares required drugs doses forms not commercially available. जो drugs बाहर commercially नहीं मिल रहा है उसको अगर patient को चाहिए, ज़रूरत है, तो उसको प्रिपेयर करना या फिर बल्क में मेडिसिन प्रोड्यूस करना ताकि प्रॉफिट ज़्यादा हो और पेशेंट को भी कम पैसा देना पड़े. ठीक है. नेक्स्ट, ही शुड बी हैविंग परफेक्ट नॉलेज. ओके, एज ए फार्मासिस्ट उसको प्रॉपर ड्रग्स और उसका मैकेनिज्म ऑफ एक्शन, उसका साइड इफ़ेक्ट्स, उसका ऑल्टरनेटिव, उसका ब्रांड्स वगैरह सब कुछ पता होना चाहिए. उसका फार्माकोलॉजी, एडमिनिस्ट्रेशन रूल्स, वो सब पता रहना चाहिए ताकि पेशेंट्स को इन्फॉर्म कर पाए. ठीक है. ही शुड ऑल्सो बी एबल इन रिसर्च एंड टीचिंग. ओके, द फार्मासिस्ट शुड कंडक्ट रिसर्च and deliver lectures on drug storage, drug uses, doses calculation and like stability issues, okay, to the junior pharmacist as well as to the nurses. Next, what are the job specifications of a hospital pharmacist? Like as a hospital pharmacist, what he will be doing? He as a hospital pharmacist, like hospital pharmacists are employed by both the MOH and private sector hospitals. They are responsible. वो लोग क्या क्या काम करते हैं? डिस्पेंस करना, परफॉर्म क्वालिटी चेक्स, फॉर्मुलेटिंग डोसेज फॉर्म्स, नया नया डोसेज बनाना, मॉनिटरिंग ड्रग मॉनिटरिंग, सेफ्टी मतलब ड्रग सेफ्टी के लिए उसको मॉनिटर करना, क्रिएटिंग मेडिकेशन बजट्स एंड प्लानिंग ड्रग क्वांटिटीज़. लाइक ये सब. ऑल्सो आई एड लाइक एज ए फार्मासिस्ट इट इज़ हिज ड्यूटी टू मेंटेन द इन्वेंटरी, to maintain records, to maintain professional behavior with all the other medical staffs, etc. Right? Now, as a pharmacist, what is his day-to-day daily tasks? First one is supervising pharmacy-related services and logistics. Pharmacy में जो जो भी काम होता है सब कुछ को overview करना, उसको supervise करना ड्यूटी है उसका. Next, he should be able to dispense the prescriptions. Okay. नेक्स्ट, प्रिपेयरिंग ड्रग्स एंड एडाप्टिव डोसेज फॉर्म. जो भी अगर ड्रग्स आ रहा है तो उसको प्रिपेयर करके देना. रिपोर्टिंग ड्रग रिलेटेड प्रॉब्लम्स टू द SFDA. ओके. नेक्स्ट, कम्युनिकेशन करना विद द हेल्थ केयर प्रोवाइडर्स रिगार्डिंग ड्रग रिलेटेड प्रॉब्लम्स. ऑल्सो ही शुड बी एबल टू अटेंड क्लिनिकल राउंड्स एंड प्रोवाइड डाटा on drug consumption. He should be managing drug interventions and medication budgets and offering pharmacy training to the students. जो भी नया स्टूडेंट फार्मेसी में ज्वाइन कर रहा है उसको फार्मेसी रिलेटेड सिखाना. जैसे कि डिप्लोमा सेकेंड ईयर कोर्स कंप्लीट होने के बाद आपको इंटर्नशिप में भेजा जाता है, तब ये फार्मासिस्ट आर द पर्सन्स हु विल बी टीचिंग यू हाउ ए फार्मेसी इज़ रन. नेक्स्ट, मैनेजिंग रिसर्च एक्टिविटीज़ रिलेटेड टू द फार्मासिस्ट. कोई भी अगर रिसर्च का काम हो रहा है उसमें फार्मेसी में तो सब मैनेज करना. वर्कलोड रिक्वायरमेंट्स फॉर ए हॉस्पिटल फार्मासिस्ट, मतलब एक हॉस्पिटल फार्मेसी में फार्मासिस्ट को कितना घंटा काम करना चाहिए. एक्चुअली दैट डिपेंड्स ऑन द हॉस्पिटल, द ऑर्गेनाइजेशन, द committee, what they decide. So everything varies on hospital to hospital. Like वर्क करेक्टरिस्टिक्स कैसा कैसा होता है उसको डिपेंड किया जाता है ना, वर्किंग आवर पर वीक, या फिर नंबर ऑफ प्रिस्क्रिप्शन फील्ड, या फिर टाइम स्पेंड वर्किंग अलोन इन द फार्मेसी, क्वालिटी एंड वेराइटी ऑफ एनकाउंटर्स विद अदर्स. मतलब आप एक हॉस्पिटल फार्मेसी में कितना देर काम कर रहे हो, कितना प्रिस्क्रिप्शन डिस्पेंस कर रहे हो, कितना टाइम अकेले काम कर रहे हो, कितना अदर काम पे मतलब आप खुद जाके काम उसमें ऐड कर रहे हो. तो दिस ऑल डिपेंड्स ऑन द वर्किंग क्राइटेरियाज और डिफरेंट टाइप्स ऑफ वर्क्स यू आर डूइंग इन द फार्मेसी, राइट. डिपेंड ऑन ऑल ऑफ दिस द वर्क लोड इज लाइक वर्क लोड मतलब डिपेंड करता है, ठीक है, पेशेंट फार्मासिस्ट का. द नंबर ऑफ फार्मासिस्ट नीड्स वेरीज. ओके, एक हॉस्पिटल में कितना फार्मासिस्ट चाहिए वो डिपेंड करता है ना हॉस्पिटल का साइज एंड सर्विसेज के ऊपर, ठीक है. देखिए, अगर किसी हॉस्पिटल में, दिस इज़ द स्टैंडर्ड, ओके, अगर किसी हॉस्पिटल में 50 बेड तक है, लाइक मैक्सिमम 50 बेड है, उसमें 3 फार्मासिस्ट होना चाहिए. किसी हॉस्पिटल में 100 बेड्स है तो उसमें 5 फार्मासिस्ट होना चाहिए. 200 बेड्स 8 फार्मासिस्ट, 300 बेड्स है तो 10 फार्मासिस्ट, एंड 500 बेड्स है तो एटलीस्ट 15 फार्मासिस्ट शुड बी देयर. Okay, now what could be the interprofessional relationship of a hospital pharmacist? Interprofessional relationship means एक हॉस्पिटल में जब आप काम कर रहे हो तो इस हॉस्पिटल में नॉट ओनली द फार्मासिस्ट, देयर आर नर्सेज, पेशेंट्स, डॉक्टर्स, ऑर्गेनाइजर्स एंड अदर ऑफिशियल स्टाफ्स आर ऑल्सो देयर, राइट. So you should be working with all of them in a good and also should be maintaining a good relation with all of them so that you work smoothly and the organization runs nicely. Okay, this should be a duty of the pharmacist to maintain a nice relationship with other healthcare professionals, right. Next, common communication techniques. Discussing issue with the pharmacy and therapeutic committee before informing medical staffs. अगर कोई भी कम्युनिकेशन करना है एक चीफ फार्मासिस्ट को किसी भी ड्रग रिलेटेड या फिर किसी भी डिजीज़ रिलेटेड या फिर कोई भी इमरजेंसी है, तो दिस ऑल शुड बी डिस्कस्ड इन डिफरेंट वेज आर देयर, ओके. तो कोई फार्मासिस्ट क्या करते हैं, पहले जो फार्मेसी कमेटी है, थेरेपी कमेटी है, उसको डिस्कस करते हैं, उसके बाद ये सेम डिस्कशन एक मेडिकल स्टाफ्स को इन्फॉर्म कर दिया जाता है. या फिर चीफ फार्मासिस्ट क्या कर सकते हैं, दे कैन रिक्वेस्ट द एडमिनिस्ट्रेटर टू इन्फॉर्म मेडिकल स्टाफ्स अबाउट इश्यूज़. कोई भी इश्यूज़ है तो चीफ फार्मासिस्ट डायरेक्टली एडमिनिस्ट्रेटर को बोल सकते हैं कि आप मेडिकल स्टाफ्स जो है उनको इन्फॉर्म कर दो, या फिर नॉर्मल एक मीटिंग बुलाया जा सकता है, ठीक है. और ऑल्सो क्या कर सकते हैं, एक इनफॉर्मल डिस्कशन विद द मेडिकल स्टाफ रिगार्डिंग द इश्यूज़. सब मेडिकल स्टाफ को अचानक से बुला लिया एक जगह पे, फिर सब मिलके ये वो बात को डिस्कस कर रहे हैं. ये हो गए इनफॉर्मल. कभी कभी फॉर्मल मीटिंग के थ्रू भी वो सब जो डिस्कशन होता है वो सब किया जाता है. तो दीज आर द कॉमन कम्युनिकेशन टेक्निक्स. एंड सो ए फार्मासिस्ट शुड बी ए गुड कम्युनिकेटर बिकॉज जो भी इशू हो रहा है द फार्मासिस्ट शुड बी एबल टू डिस्कस इट विद द higher authority so that it can be solved nicely, right. So these were the different types of techniques of communication a pharmacist can adopt, right. Chalo. Now up to this much we discussed about hospital pharmacist, all about hospital pharmacist. Next video we'll be seeing about GPP. I hope you will be waiting for the video and I'll be uploading it soon. Thank you for watching this.